So, how can we start a conversation around health planning with our client? Well, health plans might be a newish concept for equine vets, although they have been a mainstay of farm practice for some years. And one approach which has been successful in the farm sector is to identify 3 areas for improvement that you and your client agree on, and then to focus on thinking of some measures you can put in place to improve those 3 areas. And you could even go back in 6 to 12 months to see whether any improvements had been made. Introducing the concept of health planning into your practice can also be a good way to move away from relying on medicine sales and procedural fees for practice revenue towards a model of selling your services of knowledge and advice as a vet. Advice on preventive routine equine health can all be included in the clinics, and we hope that you would include that, such as worming, vaccination strategy, nutrition and dentistry. Specific health problems could also be discussed by identifying recurring themes on that particular premises and then deciding how best to prevent them in the future. For example, have you seen multiple traumatic wounds on a particular yard, or colics, or cases of respiratory disease, and devising ways in which you might be able to prevent those happening in the future. You could also look at more yard-specific management issues, such as horse fitness or foal management, depending on the type of yard. Cellulitis from wounds accounts for quite a large proportion of antibiotic usage in equine practice. So if you're seeing multiple cases of cellulitis on a particular yard, that could be an area where you could put some measures in place, such as discussing primary wound care with your client and how they should initially clean and dress a wound before it's been seen, and perhaps suggesting early veterinary intervention and thorough debridement rather than waiting a couple of days for a superficial wound and then asking your vet for antibiotics when cellulitis has already set in. Some vets have said that they don't feel they can justify the use of £250 for some health plan visits, and perhaps that might be if you've got a single horse owner. So feel free to use less of the funding if you'd rather do a shorter visit. For example, some vets have used £100 and done a short visit for some clients. It's there to be used in whatever way you wish to.